Hello everyone, here's Dr. R. Today we're going to be talking about this very interesting article that was published on the Journal of Periodontology just now in April 2024, correlating periodontal disease to coronary artery disease and the virus expression in this both disease. This study subdivided the patients in 4 groups: no gum disease and no coronary artery disease, gum disease and no coronary artery disease, no gum disease and coronary artery disease, gum disease and coronary artery disease. The coronary artery disease patients were subdivided in 2 groups: the ones that needed bypass surgery and the ones that did not need bypass surgery. The ones that needed bypass surgery, they actually collected a sample from their arteriosclerosis plate. They collected a sample from the arteriosclerosis plate and they evaluated for the virus and for the marker that they use, the PTX. PTX is a cytokine that is related to immune response, to early immune response to any aggression, okay? So what they found was quite interesting. The patients that had gum disease, they had increased presence of Epstein-Barr virus and cytomegalovirus. The patients that had coronary arteries disease had a higher expression or higher presence of herpes simplex virus 1. And they correlated the gum disease factors and the coronary artery disease factors. So, of course, on the gum disease factors, they had, higher probing depth. They had higher loss of clinical attachment level. They had higher bleeding index. On the coronary artery disease, they had higher blood pressure. They had higher cholesterol, especially the low density cholesterol, considered bad cholesterol. And they had higher tenders of sugar, also something that can be related, diabetes can be related to gum disease, as we all know now. So one thing that they found on both groups, the one that had gum disease and had coronary artery disease, they usually were on a higher age, and there was statistically significant between the groups. So this is something that we see clinically on pretty much on everyday basis, that the older patients, as you get older and you have the susceptibility to gum disease, you tend to have greater problems throughout life or as you get older. For the younger patients that we see, we always advise them to seek for treatment because as you get older, it tends to get worse. And this is the same thing for coronary artery disease. They correlated the age to be an aggravating factor for both because of exposure of risk factors, being infection, being high blood pressure, being high sugar, so on and so on, okay? So they found that the patients that had gum disease and coronary artery disease, they had a high expression of this PTX3, which was the marker that they use. So they both presented a high expression. And this was present on all gum disease cases having coronary artery disease or not, in all coronary artery disease cases having gum disease or not. But the one that had both had the higher expression of this, statistically significant than the other groups. So they said that this was very significant. As a conclusion of the study, again, they did conclude gum disease being an aggravating factor to coronary artery disease on multiple levels, being both are an immune inflammatory response. So what they hypothesized, as a hypothesis, they said that through the gum disease could be one of the gateways where bacteria or virus would come in and they would start the immune response and the inflammatory response that could aggravate gum disease. And this is a common finding on many other studies that we have reviewed and they're published. Again, as I always say, keep your mouth healthy, keep your body healthy.